So good morning, everyone, and thank you very much for joining us today. My name is Covadonga Rayon. I'm a project manager at DBN, and it is a pleasure for me to welcome you to the third session of the Cherries webinar series, Shaping Responsible Healthcare Systems in Europe, today focusing on the case of Örebro. The aim of Cherries is to support responsible research and innovation, that is RRI, projects in the healthcare sector in 3 European territories, which are Murcia in Spain, the Republic of Cyprus, and Örebro in Sweden. If you have missed any of the previous webinars focusing on the 2 other Cherries regions, do not worry, because they will be available very soon online. We hope that this webinar will be very useful for the regions that are considering applying the Cherries methodology, and therefore that could be interested on our call for mirror regions that is open until the 31st of October. So please, should you have any question or doubt, do not hesitate to post them in the chat. This call is not the only opportunity open at the moment at Cherries, as there is a second call for solutions open for the challenge of Örebro, breaking and preventing involuntary loneliness among elderly. This is a unique opportunity to participate in a co-creation process and to be one of the actors involved on the implementation of RRI in Örebro. This call will be open until the 25th of November. You can find all the information related to these 2 calls on the links that we are going to post on the chat and also on the Cherries website. But I will not take more time, as today we've got a very strong and interested panel of experts. Firstly, we are going to have Stefan Philippe. He's the project coordinator of Cherries, project manager and researcher at the Center for Social Innovation in Vienna, and he will present us the project, Cherries project. He will be followed by Martha Lundvrid and Lena Uffagen, who will talk to us about the implementation of the Cherries methodology in Örebro, and will present us the regional and national context of the project. Moreover, Lena will also moderate the discussion among our speakers after their individual interventions. Martha is a specialist nurse and has a broad experience on healthcare, both from many years of services as a nurse and as a manager at different levels. She now works as healthcare strategist and is a healthcare representative in Cherries. On the other hand, Lena works as public health developer leader in the regional development unit at the Region Örebro County. She has background on strategic municipal activities, and she is the project manager for Cherries in Örebro region. After them, it will be the turn for Simon Elbrat, who is a project manager for the pilot in Laxa municipality. Simon works at RFCSU Örebro County, which is an sports association, in the field of public health with a focus on the elderly, as well as on mental health and physical activity. Simon will present us the pilot that is being implemented at the moment in Örebro. And last but not least, we've got also the pleasure of having with us today Esteban Pelayo, Director of EURADA, the European Association of Development Agencies. Before EURADA, Esteban worked in the European Office of the Region of Murcia in Brussels, and in the Regional Development Agency of Murcia, where he coordinated the network of technology centers of the Regional Development Agency. Today, he will talk to us about how co-creation and RRI are useful for regional policies. So let's start with the first presentation. Stefan, sorry, the floor is yours. Thank you.
Thank you, Covadonga. Thank you very much for this nice introduction. My name is Stefan Philippe. I'm the researcher and project manager at the Center for Social Innovation, and I have the pleasure of coordinating the Cherries project. And in this role, I'm very happy to welcome you all here. What I'm going to talk about briefly is Cherries and the context and the underlying logics that we apply in this project. So what we are doing is responsible healthcare. We see today in healthcare that there is accelerating pressures on the healthcare system due to aging populations with chronic diseases, comorbidities, and so on. People get older and need more care, need care constantly. Also, the quality demands from the population towards the healthcare sector are increasing. And this leads to scarcity of resources because we also need to reduce the cost of the healthcare sector. Public budgets are tighter than ever. And in this context, healthcare innovation often is seen as a mean to reduce this pressure that the healthcare sector is in. So between increasing demands and the need to reduce costs, there is a demand for efficiency, and innovation seen as a tool to get there. At the same time, we really see that innovation in healthcare very often fails. Even though when you develop a solution that is proving somehow in its context that it's working, it's not adopted or spread. So there is a very big misalignment of the way how we produce innovation and the way the sectors are picking them up and adopting them. And our starting point basically was to say, okay, when we start from a demand, from a need, use the RRI principles of stakeholder inclusion and so on, then we might be able to co-create solutions that are fitting better for the regional needs and thus have a higher chance of being adopted. And that's where we started with Cherries in 3 regions, in Murcia, in Cyprus, and in Örebro. The other 2 regions were presented in the last 2 weeks. So if you want to learn more about that, you can go to YouTube and look up the recording. This is the Cherries model that basically is guiding our way through this process. We started here at the bottom up, need identification with stakeholders. We had a process that we called the call for needs. We were going to stakeholders and basically asked them to describe what is their need, what is the problem that they are facing. We were collecting those in all 3 regions. These needs were then reported through this call for needs, collected them. We selected one need in every region. In context of Örebro, and Lena and Marta will talk more about that. It was loneliness of elderly people. When we created a challenge, an open call, we were calling for solutions to this challenge. We were able to give out a grant of 50,000 euros, up to 50,000 euros, to develop a solution between the select solution provider and the stakeholders who identified the need. So they needed to work together in order to develop this solution. In a wider context, we're also doing other activities in Cherries, like mapping and analyzing, and then further developing the policy context for this kind of processes, but this is the core model. And I think that's what we should talk about today. It has also already been mentioned, we are having a call for mirror territories right now. We are inviting regions who are interested in this model to apply and learn firsthand from our experiences in Cherries. We will cover a series of services. You can find all the information on the website, and you can get direct support from our partners at Unmet. The application deadline officially is ending end of this month, but we already have been talking about extending this deadline. So if you only learn about it now, there is still some time to get the team together. All right, and with that, I would like to close my presentation. Here's some more contact details of mine and all our partnership. And with that, I'm ending and handing over to the next speaker. Thank you very much.
Thank you very much, Stefan, for this presentation of the Cherries model, which is also a very good introduction for what Lena and Martha is going to present us today. So please, you can share your screen.
Thank you, Kova. Yes, we will talk about the Örebro project, the Örebro example here in Cherries, and we call this presentation Meeting Healthcare Challenges with Social Innovations, Breaking and Preventing Loneliness Among Elderly Through Collaboration Between Public Actors and Civil Society. So this is what we will focus on. We will present the local work in Örebro and give a contextual image of the project. I can see now that I don't have the right mode. So, and also to give you a good idea of what we work with, we will start with the definition of social innovation and also a description of the healthcare system in Sweden. And then we will go on to the local project and give you an image of that. So Cherries in Örebro, we have two main actors. It's the Region of Örebro County and the Activa Foundation. These are the two main actors, but we also have a lot of other actors. And here are some other important actors. We have the University of Örebro. We have the Swedish Sports Association in Örebro County. It's a CSO that Simon represents, for example. We also have the Örebro County Adult Education Association, which is a bit hard to explain what that is in English, but it is also a CSO that gathers the adult education associations in the county. So it's a really important actor in this project. We also have the municipalities of Degerfors, Karlskoga and Laxå, and Partnership for Social Innovations. And the Partnership for Social Innovations is a network that focuses on social innovations, and the other actors on this list is a part of this partnership. So we reach these partners by themselves and also through the Partnership for Social Innovations. So that is a very good platform, and also we believe that the Partnership for Social Innovations is a really good platform for the extension of this project when this project ends. Just to start giving you an image of what we are doing, we wanted to start with explaining what is social innovation. And there is not one definition of social innovations. There are several definitions, but this is one that the Swedish Innovation Agency uses. And it goes like this: social innovations aim to activate, promote, and utilize the entire society innovation's potential, and through new social approaches address the societal needs better, in a better way than has been done so far. It can be new goods, services, methods, business model, or working methods that through new ways of thinking contribute to an inclusive society. Those affected by the problem are involved in the formulation and solution of it. The primary intention is social benefit. It's not just a positive side effect. And here we have seen that social innovation are often realized in collaboration between public actors, between private actors and civil societal actors. And we also see that increased collaboration could lead to better and more effective solutions. We also know that many of these actors that traditionally are involved in social innovation are not actors that are often strong in the field of research and innovation. And also we see that they also often have a problem with measuring the positive effects of their solutions. So therefore, the traditional innovation system often misses these actors. The innovation system lack knowledge of what social innovation is, and fail to create arena that can let social innovation thrive. So that is an important part of why we wanted to join the Cherries project. We see that this is something that we need to develop and to do better. So the healthcare system in Sweden, a little bit about that. We have a publicly funded system, and very few of our healthcare actors are private. The majority is public. We have a small proportion of private funded healthcare actors, and also private healthcare insurance is not very common in Sweden yet, but we see that this is increasing. Both of these things, both the health insurance and private actors in the field. The primary care is a shared responsibility between the municipalities and the regions. We have 21 regions and 290 municipalities in Sweden, and the state is responsible for legislation and supervision of healthcare, but most of the healthcare is conducted in the regions and the municipalities. And the regions are responsible for the inpatient care, but we have quite a large proportion of the primary care actually made by the municipalities. About a quarter of the primary care the municipalities are responsible for. So the municipalities are also important actors in this.
And the civil society in Sweden is traditionally very strong. When Sweden was a poor country, many community services started by the civil society. Now these services are taken for granted and mostly run by public actors. But what we can see now that we have a lack of cooperation between the public and the civilian sector, and this is something that we need to start up again and function again better than we have been doing the last years. Then we work sometimes parallel to each other with the same dilemma, trying to help the same group of people. And we think that we will benefit a lot from collaboration and to cooperate better with each other. Next picture. The healthcare system in Sweden is now going through a huge transformation. We have had healthcare system that is hospital-based care, and now we have to transform it to more primary care based, closer to the patient. And as you can see here on the slide, you can see we have had more of an organizational focus before. We have to have a more focus on the patient, more co-creation with the patient to get a better care. We have had a reactive care. We need to be more proactive and see the patient, as I said, as a co-creator. We are forced to think in a new way, to find new ways to collaborate and to get the healthcare to work. As you, Stefan, told us before, we have the healthcare system has to find new ways. And on this slide, you can see the demographic change in Sweden and what we are facing between 2020 to 2030. And as you can see, it's 49% more elderly people over 80. and only 3.9% larger citizens in working age. So this is a huge challenge, and we need to find new ways of working together.
Yes, and these are important reasons to why we wanted to join the Cherries program, especially the transformation to person-centered and integrated care sets high demand to work differently, as Martha said, more promotive and preventive. And there we think social innovations are a really important part of the transformation. So in the call for needs, we wanted to focus on the demographic challenge that you see here. And if we just take a closer look at the region, we have 12 municipalities in Örebro region. 3 of them are a part of Cherries, and it is Karlskoga with a population of about 30,000 people, Degerfors, a population of over 9,000 people, and Laxå with a population of about 5,000 people. And so this is 3 rather small municipalities, but with the same challenges as Marta just presented. We see that over a quarter of the population is over 65 and almost 10% are over 80. We also know that a lot of these people are living in their ordinary home without any municipality service. So they are rather healthy, but also many of them live alone. And we know that that is a risk factor for loneliness and also for mental ill health. And in the call for needs, this was a specific need was raised regarding this. That is a huge challenge in Sweden and as well as in many other countries, and even bigger now in the aftermath of the pandemic that we're in, and that is the loneliness among elderly, as said before. So this is the need that we identified. We know that long-term loneliness could result in self-isolation from social contacts and from society in general, creating a negative spiral. We also know that elderly do not want to be burdened to family and society, and the research shows that there are expectations that others will make contact. We also know from experience that people with the greatest need for social contacts can be very difficult to reach with the efforts that we have that we make today to reach those people, to break the loneliness and to offer social contacts. So with that background, with that image of our region and of our system, we want to hand over to Simon to present the pilot.
Yes. So then I will go deeper in and talk about the pilot, Cherries in Laxå municipality. We can take next picture, Lena. So this is the pilot and is written like this. Seniors leading seniors to a more meaningful and healthier everyday life in Laxå municipality. And the biggest challenge of this project is to find a person who are involuntarily lonely and then offer them a social context. Because those people do not usually participate in activities, and it can be very difficult for them to take the step to be involved or participate in activities. So that's a very, very big challenge. So to meet the challenge, Our proposed solution in Laxå is to focus us on collaboration and co-creation between the municipality, the local health center, and several NGOs, non-governmental organizations, to break and prevent involuntary loneliness among elderly. And we can say that the pilot approaches is shelling through a two-part solution. The first part consists of an outreach program that will identify and reach the target group using the collaboration organization's existing network in the area. And the second part will initiate an arena where the target group can meet and where a number of activities will be offered designed based upon their inputs and wishes. And the wishes and inputs will be doing by mapping the interest in ongoing activities now and also in the outreach activities. Yes, so the aim of these pilots are to develop a method to identify and reach the target group. It's also to provide the target group with the easy access arena that can offer a range of activities, helping to increase social context and as well helping to break and prevent involuntary loneliness. Also, through collaboration, ease the access between the partaking organizations through the better facilitate for the target group. And these aims are accomplished through collaborating organizations. And the organizations that are included in the pilot are Laxå Municipality. We have Laxå Local Health Center in Region Örebro County, Sydnärke Municipal Public Health Team, Medborgarskolan Värmland Örebro is a study association. Also Örebro Läns Bildningsförbund, RFC Örebro Län is a national sport association, and Finnrödja Idrottsförening is a local sport club in Laxå. Also Church of Sweden, PRO, the Swedish Pensioner National Organization, and SPF, the Swedish Association for Senior Centers. Yes. So here we have an overview, activity and result matrix of the first part approaches. And here we can see the activities, what we are doing, when we are doing it in the timeline, the target group, and the expected result. And the first activity was the planning for the upcoming activities, and that was done in June to July this year. And from July to October, we are planning for the outreach program, and we are now in the end of this activity plan. And the expected result is to finalize action plan here, which is done. Action plan that answers what to do, who is responsible for, and when to start. And of previously meetings and workshops, we have discussed the importance of the personal contact and the outreach activities. And we think it will increase the trust and feeling that someone cares about them. And a letter with information of activities, of what will be offered and what is already offered today, will be handed over to the target group in the outreach activity. And for example, both healthcare and home care are responsible for the outreach activities, and they meet the target group every day with a personal and natural contact. So yes, we are now in the end of this activity part, and to begin the outreach program to find elderly that identify as involuntarily lonely, and to hope to get them to take the first step to be involved in activities. And the expected result here is to reach 25 from the target group. And the last activity part, one, is planning of easy access arena. And we are in the beginning of this part and this process, but we know that we will offer an arena who is more centrally located in Laxå and arena that is not so centrally. So one is more centrally and one is not. Yes, we can take next. Yes, so in part 2, we will continue the outreach activities and start up a method named Senior Power in February, which is a program that in collaborating offers a group of seniors up to 15 persons in 15 weeks that focus on physical activity, healthy food habits, social interaction, and meaningfulness. And the expected result here is that 15 persons from the project target group partakes in this method. Yes, and the plan is also to start up a study circle approximately at the same time as we starting up the Senior Power. And a study circle, yes, is a small group of people that meeting multiple times and discuss an issue. And the study circle is focused on work-based learning. So, and the expected result here is that 10 from the project group, the target group partakes in this method. And then have a complete schedule from schedule of activities in January for both method, both Senior Power and the study circle. Yes, so it was a brief description and presentation of this pilot in Laxå. Thank you for listening.
Thank you very much, Lena, Martha, and Simon. And now that we know that how the whole process of how RRI and the Cherries methodology are being implemented in Örebro, is the turn for Stefan Pelayo to talk to us about from the perspective of a European association that gathers different regions with very different ecosystems. So please, Stefan, the floor is yours. Thank you.
Hello, and thank you very much for inviting us. I am convinced that the results of the Cherries project, what you say is the Cherries model has a lot of application for different regions. So that's why I'm going to link in my presentation. I'm going to share, I have prepared some slides. I'm going to link the presentation, what you are seeing today with the regional economic development policies and how we could implement, because I am convinced that it will be an important tool for the policy mix of the smart specialization strategies or any regional innovation strategy. So for that, I'm going to give you three things. First, to explain you the relevance of responsible research and innovation in the regional innovation policies. How, in order to tell you, because you are used for the Cherries model, but to tell you what are the difficulties to bring innovation in the public sector, which you are doing very well, so congratulations. And then later, how we could institutionalize, go beyond the project life cycle, and how we could influence on the future that could be maybe relevant for the legacy of the project that maybe you are thinking, but for sure that. And then I will finish with 3 examples of people doing similar things. So first, the relevance. So let me introduce you. EURADA, as Covadonga has said, is the European Association of Development Agency. We are gathering since 1992, almost 30 years, those people that are worried in the regional economic development. So how to support that? And believe me, and you know it's difficult because the private industry evolves very quickly, and we as public organization need or should lead and to take the guidance in order to have sustainable and cohesive growth. For that reason, we created an association 30 years ago in order to share experience, what we are going to doing today, and as well to influence in the European Union policies. We are partner of two SWAS 14 projects because it's quite relevant for us. One is Territoria, about territorial responsible in and involving actors, and the other one is Tetris. It's recently started 1 year ago about involving these RRI things in the smart specialization strategies, which is something of the things that I'm going to tell you for the legacy. So co-creation in the public sector is not easy and is less easy in the health industry. So congratulations. You know well that we have to use user-centered approach. The patient has to be in the middle of any policies, and in order to make them, as has been said already, to help them to co-create and not to use them as a client, but more as a co-owner of the system. And there are many possibilities to bring innovation. We have tests in the regions, many of them. So the things connected with the funds. So as you saw in the right side, 46% of the.
Sorry, Stefan. I wasn't sure if it was my computer, but I see that Stefan cannot listen to you properly. I think maybe can you try to get closer to your microphone?
Okay, sorry for that.
Now, perfect.
Yes, let me know if you have any problem.
Now it's perfect. Thank you.
Okay, so 46% of the European GDP is expensed by the public sector. So there are room for resources. We are able to mobilize for innovation and for the co-creation. As you can see, the amount of health is about 7% of the European 27 GDP, more than 900 billion of euros per year. So this is something, and we have, in the past, we have used the public procurement for innovation, or the green public procurement, or other activities that can help us to direct this expenditure connected with what we want to bring innovation, because there are a lot of resources. However, this project is what you call the Cherries model is even better because it's more flexible, could help us very easy to launch different goals together with the public organization and overcoming what we see as legal constraints that could difficult this type of implementation. So congratulations. As well, it's logical. We have from Eurada, we have been follow you, and you have done very interesting things in the past. So, for example, I remember the Inca project that was in Murcia was one of the partners of that project that make a center approach in chronic patient in order to bring them a more applied and more centered policies or treatments for them. We of course, all the regions know the In-Demand project, which were really centered with this challenge, and as well was very relevant. And I think the Republic of Cyprus was there together with EBN, the Innovation Societal Challenge platform. We think with the ownership of the challenge. Or the challenge policymaker, it was a good way of mobilizing the social innovation sector. So congratulations, and I think this model is a logical step forward following your track record. So you are in the logic. So, but what we could say beyond the project approach, and this is something that probably you are considering, but we should do. We should plan, because there is a lot of resources to mobilize and a legacy. And this is the main point of my presentation. I think you have developed something that could be very relevant for the policy mix of the regional innovation strategies. As you know, beyond the prioritization, the policy mix is what we are going to do. What are the tools that we use? This tool, the Cherries model, could be applied for many different issues, not only for the health industry. We could use the model approach of the demand side together with the mobilizing the possible offering entities, and as well make us more integrated, because we are finding solutions not only in our local environment, in our local ecosystem, but anywhere that could be provided. So, and I encourage you to connect with those entities in your territories that are implementing the smart specialization strategies and the operational program. For now, in this moment, we are in the second edition, in the second generation of a smart specialization strategy, and they will welcome very much this type of instruments that are bringing societal participation as the core, as the mainstream of the activity, and could be very helpful for them in that sense. Be aware that in most of the regions, the first formulation of the smart specialization strategy has been done or has been presented. However, this is a tool that evolves and is going to be adapted to the local conditions. So they will welcome you. And for sure, they are not finalized how to implement them. So the operational program connected with the structural funds are not yet writing. We are in the regions, we are now with the first draft, and we are doing the second one connected with that. So in order to show you what are other examples of places that could apply similar things, I'm going to introduce you what we are doing in another responsible region and innovation project. Here we have, for example, not very far from Örebro in Tampere, they have a continuous dialogue with the civil society in order to make it more sustainable, the policies. As you know, sustainability is one of the key elements of the future growth of the European Union. We don't only consider sustainability as for the societal benefit, but as well as a competitive advantage of the European industry in the world, and will be part of an important part of the economic recovery. In particular, more than 30% of the funds dedicated to economic recovery coming from the European sources should be dedicated to sustainability. And there are regions that already have a tradition of dialogue with the civil society, and this one is in Tampere is something that is doing. In Karlsruhe, they are using this project to establish dialogue among policymakers. So the idea to do something similar to what we are doing is to establish a fluent and not binding testing dialogue where all the people in charge of designing policies connected with the regional economic development and are taking forum. And so they discuss this type of things, which are quite relevant. Szeged is in Hungary, and is a city where they are using challenge proposed worldwide in order to make a better dialogue with the citizens. For example, the 100 Intelligent City Challenge at the end force you to establish a policy, a long-term policy that not only depends on the public administration, but as well in the civil society needs. And finally, Cantabria is using this project to expand the stakeholders of the smart specialization strategy. I come back to the need of institutionalization. I think it is quite relevant. And then they are using that they have a well-functioning offshore energy strategy where they publish that. So I'm going to conclude. First, I feel honored to be here. Second, because this project is very practical, so congratulations for that. And the idea is, I think, you are a model, and I encourage everybody that is listening to us to be a mirror region, because they will learn a lot from you if they are one of the selected region. And I encourage you to go beyond the project life cycle. I'm sure that you are there, and use this model as a part of the policy mix for the regional innovation strategies, not only connected with the health sector, because it has many applications in other industries, as you may know. thank you very much for your attention.
Thank you so much, Stefan, for joining us today and for this broader vision on what is being done in other regions. And because as you said, it will also be very helpful for the sustainability of the Cherries model and the future exploitation of our activities. So now I'm going to leave the floor to Lena, who is going to lead the discussion we are going to have. And I'm sure that will be very interesting with after these interesting presentations we have had. Thank you.
Thank you very much, Kova, and thank you, Stefan, for your very interesting presentation as well. I thought I would start with answering your question about the smart specialization strategy and if we have any connection to that. And we do. We have a strand in the smart specialization strategy that focuses on mobilization and inclusion, and that is something that we are discussing a lot, actually, with the people that work with the strategy, how we can use the Cherries method and the work that we do in Cherries, and to develop that as a part of the mobilization and inclusion connected to the smart specialization strategy. We, as you may have noticed, we focus a lot on the public engagement aspect in the RRI. So we hope to be able to develop that work further in the project as well. So I was wondering, when it comes to social innovation, we know that it has a great potential when it comes to regional development and growth. And as I said earlier in my presentation, the Swedish Innovation Agency, Vinnova, states that the traditional innovation system often lacks knowledge about social innovation, and also has a difficulty to managing solutions that aim to create societal benefits rather than generate profits. The systems are often very focused on economic growth and economic, when it comes to monitoring and so on. So I want to know if you, all of you, have any ideas about how we can overcome the obstacles for social innovation, like these and maybe others that I haven't talked about now. Do you have any thoughts on that?
I would just like to step in here. First of all, thank you all for your presentations. Very nice to see all this work. Esteban, basically, I think without knowing it, described the work that we have ahead in the last year of our project. We will work on policy mixes. We will work on the integration, on the overlaps, the interfaces between RI and smart specialization, and how we can use the model that we are having as a tool to enhance smart specialization strategies. I was thinking like this call for needs is basically what could be a version of the entrepreneurial process of discovery, because we are really working with stakeholders to really identify demands. And here we are on, and that is then the connection to what Lena said. We are working on a side that has been a little bit, had too little attention in innovation studies, is the demand side. And but also had too little attention in innovation studies are things that we don't see. Like innovation studies tend to focus on technology, on patents, on publications, on tangible artifacts somehow. And social innovation, but also service innovation in general, is invisible. It's happening between two people. It's changing the relationship between people. And because we don't see it, we tend to overlook it. These kind of things tend to remain hidden. And at the same time, we know that it's extremely important. And when we're talking about, this word has also been used, I think, by Lena, we are talking about transformation somehow. Yeah, we want to change the status quo towards a new system configuration that is more desirable. So we need some kind of transformative approaches. And when we want to transform something, we need to change the relationship between system actors. Yeah? We need to change the way things are being conducted. And that's exactly where we need to go. And that's why these things will be more important. And I think in general, there is a trend towards valuing social innovation, other forms of innovation more with these transformative approaches towards innovation policy, towards policy in general. But it's still extremely challenging. That's where we will need to make an effort, and there will need to be an effort that goes beyond the project, of course, because we have like 14 months left and we cannot reinvent the wheel, but we will do our best to prepare the ground for further actions. And last comment, Andy, you already mentioned the definition for Vinnova, and I think when we look at the working models that Vinnova has, there is a lot of things that we can learn because they are really leading the work on transformative innovation and how do we need to reorganize the way we are doing innovation policy in a very broad context, very broad sense. When we talk about transformation, they are really among the institutional entrepreneurs, so to say, in these terms. So this is some context that we also need to strengthen. Yeah? And I don't know if that is answering Lena's questions in any means. It's just a very, very broad context that is really relevant for the work that will come up. Yeah.
Thank you, Stefan.
Yeah, I think Esteban, yeah, he wanted to add something.
I would like to tell you that we discovered social innovation in reality after the crisis of 2008, 2009. From the point of view of economic development, we discovered that this type of initiative were able to be resilient to the most difficult conditions that we face there, and as well to create employment, even in the crisis moment. So from the point of view of economic development, we were talking for years before, for decades, let's say, but really we started to discover after 2008, 2009. And there we make a strong analysis about how we could support them. In discussion as well with the promoters of social innovation initiative, what we discovered is that we don't need to put them in a cage to say these people are very relevant, let's pump public funding to them. What we want, what they ask us, and what we offer now, the most innovative entities, one of them is Örebro. Örebro, by the way, is very advanced on social innovation. Let's say, everybody, you are a reference, is to include them, to adapt what we do as economic development agencies to support the growth of entities adapted to them. So this is the most, so we don't dedicate special funds, but we adapt different or activities to those type of entities. And for that, I think the obstacles, first, we need a law, because public organization, public regulation is better to recognize them. So to have a certificate or whatever. As well, we need programs that will welcome a program of research and mainly innovation that could have things that are adapted to them. So imagine that you have an entity that is recovering waste, and you with people with disabilities, maybe they need a special workplace or special tools. So this type of things should be supported. And the final is to finance them. Having coaching or mentoring specific dedicated people to support them to get not only public finance, but as well to mobilize private finance. This will be my recommendation to eliminate obstacles for social innovation.
Thank you very much, Esteban. Another matter to discuss is when it comes to the civil sector, we know that it's very diverse. It includes everything from big multinational associations with large number of employees to small clubs and groups of people that are maybe volunteering in a very limited area in society. And we can see in the project that this diversity is a challenge, as we tend to do things in a way that maybe risk to exclude actors with the limited resources and capacity. Do you agree with this? And if so, how can we give the civil sector better prerequisites to become a bigger part of the innovation system, or maybe better access to the system? Any thoughts on this?
Yeah, I can start. So give Esteban a minute to think about a very, very difficult question. I think the only way you really can handle this problem is by continuous support and continuously trying and building a culture of including them. You need to create partnerships, you need to create trust, you need to empower people to be welcome and feel welcome and be able in this context to contribute. We are talking about very, very difficult things like Cherries Healthcare, about innovation, about policy that are extremely abstract. They are ongoing negotiation processes between agents, and then traditionally these groups that you mentioned are not at the core of this multi-level agency that is shaping this environment. And it needs competences, it needs resources to be able to participate there. And I think, and it's not only the competences of these groups, those are the competences of the other groups, of the other agents in this context. Therefore, the public administration, they need to have the competences to mobilize this kind of stakeholder groups. It needs the competences to understand the gaps in knowledge and the gaps in language, in culture that are present when we jump between spheres, so to say. And now actually, and Esteban already mentioned it, I actually think in Örebro you're really, really good with that. So the Partnership for Social Innovation is one of the best arenas I've seen in this context. Yeah, this is really very advanced work, and I think actually that we can learn a lot from Örebro. And that's something that I did not mention before, is also like, it also shows in the context of the Cherries model and how we do the work in Cherries. Yeah? We have 3 regions, and we said, okay, this model is basically a blind process, and we need to make it fitting for the regional context. It must be embedded in the regional culture of doing things in the regional place-specific contexts. And then, for example, in Murcia, where they had this long tradition of engaging doctors in developing innovations as inputs for the healthcare sector, they come up with innovation that are based on state-of-the-art ICT technology. While you in Örebro, with a very different background, use the same model to come up with a social innovation. And I think that shows, at the one hand, the flexibility and the strength of the model, and the other hand, that you always need to build on what's already there in order to make it work. You can use it as a tool to build on strength, and that's the way to go. Yeah. But that's already, at the end, I was already, again, very far away from your question. I'm sorry for that.
If I may as well, last week it's because we organized our annual event. This week we organized about how to finance, impact finance, we call. It's Agorada, excuse me for the publicity, but I was talking with one of the moderators, which is a social entrepreneur. He has a catering involving people which are excluded. And we were talking that it was very easy to create social initiatives, but it's not so easy to scale up. And we organized this week, Thursday and Friday in Valencia, what we call Agorada, on finance, impact finance for social innovation and sustainability. And I'm going to, beyond the publicity, I'm going to give you some examples of things that has been done in that line to help social innovation to scale up, to be grow, and to be more important, as Lena was asking us. For example, the development agency of Catalonia, Acció, which is very focused on internationalization, they thought 2-3 years ago that it was good to have social innovation initiative and to treat them as the other companies. So they helped them to participate in international tenders, tenders of the United Nations or the European Commission or other public organizations. So to bring as buyer the offering product to this type of entities, and they have a lot of success. And as well, they bring them to other countries, because every social innovator what thinks is that the problems is in their territory, but elderly alone people are in Örebro, but as well in many other places. So the solution that you are going to develop in Cherries probably with adaptation could be useful in another European territories. So this is one of the examples. Another good example is IFCA in Hungary. They have a program to support the capitalization of social enterprises with something that is very good. If you fail, they have like a different stage of capitalization, something like you are doing with the experiments. However, if one of the applicants fail in one of the phases, they immediately offer them mentoring support, because it's not a pass, no pass. What they want is to have an inclusive program where all the social innovation initiatives will be there. And like that, unfortunately, there are not yet many examples, but there are more and more examples of treating companies or initiatives in social innovation and helping them to scale up.
Thank you very much, Esteban. For sure, it's very interesting also for us to know what other initiatives are going on and also what they are doing. I'm afraid we are running out of time today because the discussion was very interesting, but I'm sure we will have more occasions to continue it. So thank you so much, all the speakers, Esteban, Stefan, Lena, Simon, and Martha. It has been very interesting to know how the Cherries model is being implemented, but also to realize how important the work developed during the project is, and also the opportunities we are having ahead to collaborate in the implementation of co-creation processes and RRI in the different regions in Europe. So thank you very much for today.
Thank you.